Welcome everyone to Something to Talk About from the Bainbridge Island Senior Community Center, sponsored by Fieldstone Communities, Bainbridge Island. Fieldstone offers innovative and compassionate care, now accepting residents. They also offer day stay and respite programs. Call 360-689-4314 to schedule a tour of Fieldstone's beautifully appointed apartments on Rolling Bay today. And I'd also like to take a moment to acknowledge that the Senior Community Center is on the ancestral homeland of the Coast Salish people, specifically the Suquamish tribe, the people of the clear salt water. We honor them and we are grateful for their hospitality. So thank you everyone again for joining us today. It's my pleasure to have with us Jennifer Calvin-Myers from Kitsap County Aging and Long-Term Care Services. Jennifer's here today to talk to us about some basic brain health, some tips for safely taking and disposing of medications, and just some overall strategies to keep our brains healthy and happy. So Jennifer, I'm going to turn the mic over to you. And also, if you wouldn't mind taking just a quick moment for those of us who aren't familiar with Kitsap Aging and Long-Term Care Services, just tell us a quick bit about the organization and what you all do.
Sure, yeah. Thank you so much for having me today. So Kitsap Aging and Long-Term Care, they have a main office in Port Orchard, but they are a government entity that serves the whole county of Kitsap County. And the office receives funding from the state of Washington to do a lot of different services and programs in our community. The Older Americans Act is a main one, and that provides information and referrals for seniors age 60 plus. And it also supports family caregivers of an adult 18 plus with some type of functional disability. And we also have information about dementia support. We have a dementia specialist who can provide a consultation with individuals, either themselves or their friends or family that are helping care for someone with dementia and maybe have questions about the disease or behaviors. We also have Medicaid long-term care case management in our office for people that are on programs such as like COPES or CFC. So we have a lot of information and resources. And I did want to share as part of the introduction for the presentation today, our website, because the presentation today came out of feedback that we get from the community. Every 4 years, we conduct an area plan, which is where we get information through a survey from our community members about what is on their minds, what they would like to have services and support look like in their communities. So from last area plan, we heard people had a lot of interest in healthy aging and brain health. And so with that information, the medication component came in. We also received funds from the state to provide education specifically around medications and safe use. And so really that topic blends well with our brain health and our overall healthy aging in our any stage of our life that we're at. So I wanted to show, I'm going to share my screen because we're in our area plan survey again for the next 4 years. And so people can go to our website, the agingkitsap.com. And if you scroll to the bottom of the agingkitsap.com, there's information here about our area plan. And are you all seeing the website right now? Okay. So you can come here and read a little information about it. And then further below is the description of, like I mentioned, kind of what the purpose of the survey is about. And then there are links to take the survey online, either in English or Spanish. And you can also contact the office if you'd like a paper copy mailed to you. You could fill it out on paper and we'll give you a return envelope to return it back to the aging office. And from that information we take into account the requirements of our funding for types of programs and services, and then we try to incorporate the needs of the community and what they're telling us of interest to then also try to factor that in if we can plan and provide services in those areas as well. And so like I mentioned too, that's how we got today to talk about healthy aging in terms of our brain health and our medication management. But I do see a chat. So Katie or Reed, do you want to take chats as we go or?
Well, I just wanted to pop in here and say that there are copies of the physical survey available at the front desk at the senior center. And so you can fill one out and it has the self-addressed form that you were talking about. Yeah. So if you just want to drop by, we can give you one here too.
Yeah, we'd really appreciate it. We really go through, I've been part of the planning process after we get information. And so we have Tanya is listed on our website. She's our planner for community programs and services and contracts. And so Once all this information is collected, our management staff go through it and we try to brainstorm around ways we can provide services or maybe partner with other community organizations. So your information really is looked at and valued and used in our planning to help support the community. So we appreciate it. Thank you.
Deadline is March 31st.
Yes. Yeah. Thank you. Yep. Right here, March 31st. So it's coming up quick. It's been out for a while, but here we are today. Time kind of flies, doesn't it? Okay. So I'll go ahead and get us going on our presentation for today. So we're talking about brain health and medications. And like I mentioned, the focus of this presentation is about safe use for medications. But like I mentioned too, the brain health is really kind of at the forefront of people's minds, you know, as we go through our aging process. So the first thing we'll do is take just a quick look at brain basics. Then we're going to look into some aspects of brain health, and then we'll move into medication management or tips for safe medication use. And then we'll finish by looking at some disposal options here locally in Kitsap County for unused or unwanted medications that you won't be taking or finishing. So brain basics itself, it's just a reminder that our brains are pretty small, weighs around 3 pounds, but it does a lot for us. So on the bullet items, these are the main areas that our brain is really working to help us achieve in every day, every minute, every second of our life. So it's going to be interprets the senses, and it controls intelligence, body movement, behavior, the body's vital functions, our sleep, management of emotions, and integration of sensory information and memories. So that one's kind of cool too, just because, you know, you might smell a smell and that goes with the memory, or you hear some piece of music and then that connects the memory for you. So on a basic level, it does the day-to-day things, and then it does some pretty powerful high-level interactions with our emotions and our memories and all of that. And then as far as brain health, when it's kind of thought about in terms of, well, what defines brain health, it's really about what the bold text says, you know, how well a person's brain functions across several areas. It's not just one, it's a lot of them. And those basic just categories include cognitive health. So that's how we're thinking, we're learning, we're remembering. Our motor function is making and controlling movements, including our balance. So we often think about, you know, our exercise and our fitness and our balance, and a lot of that is right there connected with our brain, not just our muscles and our just strength abilities, but our brains too. So that's a pretty cool connection. And emotional functions, it's interpreting and responding to our emotions, and tactile functions, so that touching, feeling of the sensations in touch, include pressure, pain, and temperature. So this picture is kind of cool here because it really brings in everything. It looks like people might be using their cognitive health. They're kind of thinking and learning maybe some new dance steps. Their motor functions, they're definitely moving their parts of their body. Emotional, you know, they're having some emotions that they're getting themselves and responding to others. And then that tactile, you know, they're touching, their feet are touching the ground, their hands are touching each other. So something just looks as simple as dancing that we think is, you know, pretty common, takes a lot of our brain power and all the functions, you know, working together to make it happen. And then our brain health can be affected by quite a few different things. And it's not just one, but little bits along the way, or one big thing can happen and impact our brain health as well. So age-related changes in the brain, injuries such as stroke or traumatic brain injury, mood disorders such as depression, substance use disorder, or addiction, diseases like Alzheimer's disease, and our nutrition, our physical and mental activity, and then our social connections as well. All play a part in how our brain health can be affected. And that could be for the better or maybe for the worse. It just kind of depends if it's being maintained or if maybe there's some deficiencies in areas. And then our lifestyle factors, when we think about, well, what can support those areas of brain health and maybe keep those other things from happening that might affect negatively as far as maintaining our brain health, there's a lot of different lifestyle factors. So a lot of our habits we kind of come to over time really can have a great impact, but we can also change our habits at any time too. And even small changes can really add up. So it's not like you have to feel pressure to do all of these. You might already be doing a lot of these. Some of them might have been on your mind that you're thinking about. It's just a kind of a reminder check-in of those different factors. So the first one is taking care of your physical health. Then we have managing high blood pressure, eating healthy foods, keeping your mind active, also being physically active, staying connected with the social activities, managing our stress, reducing risks of our cognitive health, And then also the taking medication safely, which I mentioned will be part of the main focus of the rest of our presentation today. But there's quite a few things we can do. So I think that's really awesome too, because even if you feel one of them might be a little overwhelming to feel like you can master it, there's usually somewhere in your life you can make some type of trial run. It may be changing something if you feel like you need to. And then it's great reminders too, that if you're already doing some of these things, you kind of get to pat yourself on the back for today and just know that, you're really doing something that's going to help maintain your brain health. So the tips for healthy use, I've got this broken into three different sections. But the reason for talking about medications and healthy use is what's here on the screen with us. So medicines are intended to help us live longer and healthier, but taking them the wrong way, mixing certain drugs or supplements and foods can be dangerous. So the intent is usually good. It's just sometimes things can go a little haywire when they, like it mentions, get mixed, or if we accidentally take something the wrong way that we didn't really know needed to be a set certain way. So the other thing with medications and vitamins is that having multiple medical conditions and taking multiple medicines can increase the risk of negative medication side effects, which then that could impact our brain health. So basically it's just a numbers game. The more medicines you're trying to take, that harder it can be to manage all of that. And then the tips below, like I mentioned, we're going through these just to reduce your risk, and then have that be one strategy is maintaining your brain health. So as we go through this presentation, if you have anything that comes to mind as far as brain health goes too, at the end, I'm going to just see what you thought about the presentation and have some feedback, because we're also interested in being able to provide other presentations for the community about topics that you might want a little more information on that we didn't talk about today related to our brain health. Okay, and then there is a chat. Reed, is that left over from you or is this a new one?
That's left over from me.
Okay, I just must not have clicked it yet. Okay, so the first tip that we're going to talk about is basically about communication. So off to the side here from this picture are bulleted areas with the main takeaways for the tips. So the first one is asking. So ask your healthcare provider or pharmacist if there's any unsafe interactions between what you take or with certain foods. So the like any medication you take, sometimes there's interactions between them, or it might be with some food that you might take. So you might need to either avoid that food or maybe stagger it for a certain amount of time around when you take each medication. The other thing that I will stop and say as I'm starting to talk about the tips, one thing for you to know is I'm not a pharmacist, so I don't have specific information that I can share with anyone today about your particular situation with medications or health conditions. All of this information was sourced from different medical organizations that have already put it all together for us. So this is just kind of some general high-level information. So the second tip about communication with medications is telling healthcare providers or pharmacists about all the prescriptions that you take, even over-counter medicines or vitamins, any allergies or problems you've had taking medications in the past. And that's because some medications are what you'll hear called like sisters or brothers of or a cousin of another medication. So you might not know the name of a medicine is something that might have a harmful effect for you, but it might be a close relative of another medication. So that's why you'd want to share any medication issues you've had, just so that that doctor and pharmacist can be aware of it in case they cross over enough that they might want you to avoid it. And then any alcohol, tobacco, or drug use, these can just change how your medicine works. So even if you use any of those a little bit, or if you use it quite a lot, sometimes any combination of mixing them could have an effect. So that's why that's important to talk with your healthcare providers and pharmacists about any alcohol, tobacco, or drug use. And then any problems or questions you have about the medicine or even vitamins that you're trying to maybe bring into your regimen for just overall health, because there could be something else you could take instead. So you wouldn't want to just assume that, there's nothing you can take if you have any problem with the medicine. It just might mean you need a little something different. And then any concerns about taking too many medications or that the medications aren't working. So you'd want to talk with either, again, healthcare provider or pharmacist about that. And that's because you'd want to find out if maybe there's something else you can do or if you can safely stop or change that medicine, and then how, because you wouldn't want to abruptly stop it without consulting with a healthcare provider or pharmacist first, because that could have some consequences in of its own that could cause other problems. So you just want to take a staggered approach and just be communicating with your providers about that. So the second tip for taking medications is verify and organize. So before leaving the pharmacy, it's really a great idea to check that label on your bottle and make sure that that medicine's for you. It's the medicine that you expect, and that the directions are clear, or that they're ones that you're used to. We trust our pharmacies after a while. We get to know them, they get to know us, and the systems seem pretty automated and computer driven, where maybe there's not a lot of chance for a mistake, but mistakes happen. And unfortunately, that's why they're called an accident. We don't plan for things to happen like that. And you just wouldn't want to get home, take your pills and put them in your pill organizer, and then just later find out a week later that, oh my gosh, this wasn't my bottle, or this wasn't my medicine, or it was the wrong one. So that's a great first step, just checking that bottle before you leave the pharmacy, because once you leave, sometimes it makes it a little harder to return medicine. So it's great to do it right then and there before you leave. If you use a drive-through pharmacy, just do it in the car before you pull away. And then taking that medicine at the same time of day for each dose. So if you're told to take it once a day, trying to be really consistent, because all of them have different, if you call it like half-life, or the just chemistry of them, when they peak and kind of decrease as far as how they're getting the medicine through your body. So keeping a consistent time of day is really helpful. And turning on a light, sometimes we don't even think of that, because we think, oh, I know where my pill bottle is, or I know where my organizer is. I just forgot to grab it before I went to bed, and we're doing things in the dark. And this is a story that happened to me recently that kind of feeds into the next bullet. So I'll say that one first, and then we'll talk about my story that happened. But organizing each person's medications separate from each other. So if more than one person in the house is taking medicines, it could be a really good idea to just kind of keep them put in separate areas, so you don't accidentally grab bottles of a different person. Or if you already put them in pill boxes, keep those pill boxes separate as well. And that includes pet medications too. So my story is, I was actually in the kitchen. It was morning, but it wasn't light out, and I didn't really have many lights on. One of my pets actually just started taking some medicine for her thyroid, for our cat. And so I have a pill bottle for her. And then I had to take antibiotics for a sinus infection. And I had my cat's bottle out, but I also thought that I'd already put my antibiotics out, because I fill my cat's pill organizer 1 week at a time. So I'm not used to really having her bottle on the counter. I would be more thinking it was my bottle on the counter just for my, week that I needed to take my sinus infection medicine. Lo and behold, I forgot to put my cat's bottle back. And it was my cat's thyroid medicine that I almost took. And so I had grabbed it and I went to take it. And I'm like, okay, whose is this? And I looked at it and I saw, wait a minute, that's not for me. And it was in the dark as well. So that's why I think initially I didn't notice the bottles were too different. So it can happen pretty innocently, it can happen pretty quick, but just having our lights on, keeping medicines organized separately, including our pets' medicines, is a really good idea, just to kind of hopefully prevent an accident from happening. So part 3, tips for taking medication for accessing and consuming. So sometimes it can be troublesome for the access part, even opening and swallowing pills for the consuming part. So the first thing we'll review here is, if you have trouble opening bottles or reading the labels, talk with the pharmacy. They can often offer easier to open alternatives as far as bottle packaging goes. Also asking about larger print. Sometimes they can make larger labels off of your bottles. And then there's also technology for apps on phones. If you have a smartphone, that your phone could, with a certain tagging, they can be pointed at your prescription label, and it could read, like speak out loud, the details of that medication label. So then that might make it easier to know it's in the bottle if you're having a hard time reading it. So you can talk to your pharmacist about those options. And then if you're having trouble swallowing pills, telling both providers is a good idea. Your healthcare provider may be able to help you find out why the trouble of swallowing is happening in the first place, and maybe there could be a way to improve it. So that's why healthcare provider is a good person to keep in touch with. And then the pharmacist as well might be able to advise on options or alternatives for how you take that medicine. The last little bullet there does mention how you wouldn't want to chew, break, or crush tablets without first checking with your pharmacist. So some people think if they're having trouble swallowing, they'll just chop them up. The trouble is sometimes when you alter a medication, it'll change the way that it works in your body. And then it may not work as intended if you've altered that, the structure of those chemicals in that pill. So that's why you just want to ask a quick question to them to see if there might be another way you can take it, or they could work with you on some ideas. And then when you're starting new medications, it's kind of the same idea of, just being pretty thorough and communicating with your healthcare provider. But basically the reminder is, again, to talk about any allergies or problems with medicines that you've had in the past. And then also asking these list of bullets here. So is it safe to drive with the medication? When does it start working? When or how will you know if it's working? Because sometimes we wonder that too. Do you need to stop or change any other medications you currently take? And then what potential side effect could occur? And then what do you do if that happens? And are there any special instructions for taking the new medicine or supplement? Because again, if you're adding any supplements or vitamins, that could affect things too with your other existing medications or vitamins. And then what do you do if you miss a dose? And will you need a refill? And if so, are there any prescribed now? Sometimes when you get a new prescription, it has 0 refills. Sometimes it has 2, 3. So you just want to make sure you know where you stand on those. And do you need an appointment before a refill is granted? Because sometimes appointments are hard to come by. They don't, sometimes there's not openings really quickly. So you might want to book an appointment in advance if it's something your doctor tells you, you may need an appointment first. So that's why just kind of asking those things ahead of time might be helpful, just so you don't feel like you're in a pinch when you need it later. And then medication disposal. So again, sometimes we change medicines and then we're kind of left with the pills and we don't really know what to do with them afterwards, and they pile up, which that in of itself, as we'll read here, could be dangerous too. So disposing of medicines are really meant to reduce the risk of others taking them accidentally or misusing the medications on purpose. And so to do that, first you want to check the expiration dates on your medication bottles so that you yourself aren't taking expired medications, and then safely discard any unused or expired medicines as soon as possible. So one way to think about the options to do that is there's a link through the FDA about where and how to dispose of unused medicines. But we're going to actually take a look at these options as well too. So we'll have a little bit more details for some local options. So MED Project is a medicine return kiosk, and they are in Kitsap County. So the state of Washington is part of the process for this, but Kitsap Public Health has a website that they've got all the information for you. And so it will have information about drop-off kiosks that you can look up by zip code, and then also about mail-back return envelopes in case you can't make it to a kiosk, but you need to get medication returned for safe disposal. I'm going to try clicking this link and see if this will work for you all. Do you guys see the public health? Yep. Okay. So when you go on this page, it talks about now in Kitsap, a safe and convenient way to dispose of unwanted medicines. And then you can search, if you keep scrolling down here, there's a location of kiosks in Kitsap County and the request and mail back envelope one. Then there's more information, and we're going to review this as well in a minute in our presentation, but it reviews again what is accepted, what's not accepted, talks about medical sharps for any needles, and then why you should, be trying to figure out a safe way to return medicines. I'm going to do a quick kiosk lookup on this locations. So it takes you to the general page for Washington, and then it does the find a location or the order mailback supplies. So we'll click the find location. And then if you put in the zip code for where you are at and hit search, and then you need to just scroll below, and off to the left, you'll see a list of the locations and their address, phone number, and hours of operation. I'd probably call ahead just to make sure everything is like it says in the list. But yeah, you'll get a list of locations in your zip code area. And you can just scroll through that, and then it extends to nearby areas once it's shown you the immediate location options. So you'll have some ideas. So Bainbridge Island, it's saying Rite Aid, Safeway, Bainbridge Island Police Department are the 3 locations. So I just wanted to demo that for you real quick. But back to our presentation, then we can start looking at return locations, what medications are usually accepted, because they don't take everything at these. So basically, most prescriptions and over-the-counter medicines can be returned. Medical sharps will not be accepted. So those do have a different protocol, which we'll also review. Drugs sold in any form, so solids, liquids, patches, and used by individuals, not businesses. So that's one distinction. This is meant for individuals. And then including these items are what would be accepted. So prescription and non-prescription, brand name or generic, and medicines that were for veterinary use, pre-filled auto-injectables such as EpiPens are accepted via the mail-back envelope, because those are a little tricky because they've got the medicine and the pen all kind of in one. But in the mail-back envelope, that could work. And then the no items are medical sharps, the needles and syringes, and the empty EpiPens. So if they've already been used, they would kind of still not fit there, even if the medicine's not in them. Vitamins or supplements. So that's interesting. I kind of thought that would be included, but that's a no. And then the herbal-based remedies as well, homeopathic drugs, products, or remedies. Also, they won't take back any cosmetics, shampoos, sunscreens, toothpaste, lip balm, antiperspirants, or other personal care products, and any pet pesticide products in pet collars, powders, shampoos, topical applications, or other forms. So I kind of think about like flea medicines or flea powder, flea collars, that kind of thing in a general way for pets, so that those wouldn't be accepted at a take back. And then what to do with the unused or unwanted medical sharps. So state law does prohibit putting these into the garbage, into the trash. So to find a safe and appropriate way to dispose them, pharmacies sell sharp containers. Usually they're little red plastic containers with a circle top that you can safely get the needles put into. And then at the Kitsap County Solid Waste webpage, you can look up, there are usually all throughout the county at the waste disposal and recycle centers, they can accept these sharps containers so that you've had a safe place to dispose of them that won't be in your garbage. And then the Kitsap Public Health has information on their website as well. If you find a sharp, some people try to take care of that themselves and throw it away and get rid of it so it's not out in the community, but there's some tips about basically don't touch it, just contact them and they can figure out getting somebody maybe to pick it up. Or if you are going to be so inclined that you want to remove it yourself, they do have some tips about how to do that, which include not touching it. There's some ways that you can get a receptacle near it without you actually touching it to pick it up off the street, for example. But there's information on the website about that, or you can call the Kitsap County Public Health. And then we'll move into disposing of medicines at home. So this is a reminder that when a take back option is not easily available, there are two ways to dispose of medications at home, and that depends on the medicine. So the first one we're going to talk about, the method is flushing medications. So some medicines could be especially harmful to others if they were to be found. And so there are specific directions to immediately flush them down the sink or toilet when they're no longer needed. And a take back option isn't readily available. So some people don't know, how would I know if my medicine needs to be flushed versus one of these other methods? The second bullet here on the screen under the how will you know talks about checking the label or on the patient information leaflet that you get with your medicine, or you can call the pharmacy and ask them if it's on a flush list is the easiest way to probably ask. Or there is a list from the US Food and Drug Administration for the ones that are recommended for disposal by flushing when a take back option isn't available. And the reminder is, don't take this blanket approach to flush everything. It's really only a select few that have that designation that really would need it versus just putting it in the garbage the way we're going to review next. So not everything would do the flush option. There are concerns people have over environmental concerns with flushing medications. So there is a specific list for a specific reason. And then disposing of medicines in the household trash, that's the second option if you're going to be disposing at home and there's not a take back program or location kiosk available. Basically, it's almost all medicines except the ones that are on the flush list can be thrown into your trash. So the way to do this, it would apply to anything that would be over-the-counter medicines, liquids, pills, drops, patches, and creams. So the steps are from the Food and Drug Administration, what they recommend is first you remove the drugs from their original container. Then you mix them with something undesirable, such as coffee grounds, dirt, or cat litter. This makes the medicine less appealing to children and pets and unrecognizable to someone who might be going through trash looking for it to intentionally abuse the medications possibly. So then after you've put it into something undesirable, then you put the mixture into something you can close. A resealable zipper bag or an empty can or other container that would have a lid to prevent the drug from leaking or spilling out. And then you would throw that container into the garbage. And then on your packaging that's remaining, you would want to scratch out all of your personal information and then take that the empty package and throw it away or recycle it if it can be recycled. And then if you have any questions about your medicine and disposing of it, it's still going to be a good point of contact with your pharmacy or your provider who prescribed it to get information about how to take care of any unused or unwanted supply that might be left over. And that's all we had to talk about for the brain health and medication. So I'd say awesome job being here today, listening to this information, or maybe viewing it later on a video when you can get to it. That's one more step in your healthy aging journey. So we're very happy to be here with you for that and provide some information just for some reminders, maybe something new you didn't know yet. Either way, I think everyone's doing their best to manage all of their parts of healthy aging. So I appreciate you being with us and going through the information. Our office also has a couple of items that might help with medications. We provide for free, no cost to you. We have locked or unlocked medication organization box, like pill boxes. And then we also have information pamphlets about safe medication storage. We also have handouts and booklets that you can write down your medication names and why you take it. Sometimes that's really convenient when you're going back and forth to the doctor or seeing specialists. They tend to ask you, every time, even though you were there two weeks ago, maybe, what list of medications are you on? So having it in an organized place that's easy to carry back and forth. We have some handouts that might work really well for you for that too. And so our contact information's here. You could call by phone, email to ask for those. You can also look at our website, like I mentioned, just in general for information about what else we provide in the community. And then the note too, if you do email us, just a reminder not to include any private information. As a county government, we're subject to public disclosure. So if you were to send an email and someone in the community or the public made a request to see all the emails received, your email might be one of them. So that's why you'd want to just be very minimal in your request and don't put any private information into emails. Okay, so that's all I had from me. I can stop sharing if any questions came up.
Yeah, thank you so much, Jennifer. That was just great information. I know Reed had typed in that it's great to know that we have so many options as far as disposing of medications go. So that's great. And yeah, and if for any reason somebody is unable to track down that website or information, again, you can call Aging and Long-Term Care Services. You can also call the Senior Community Center. We can also make sure that we get you a list of those different locations as well. So yes, great information. I'll also open it up again if anyone else joining us has any questions they'd like to ask. Jennifer, I also just want to again mention the area aging survey that is going around right now. That's going to be open and available to folks through March 31st. Again, this is a great way for folks to be able to have their voices be heard, to give input on what our area agency on aging is doing for our community. So if you do have time, please go ahead and check that out and fill out that survey. Again, there are paper copies available.
I was going to say too, I'm going to share my screen one more time. I wanted to show on our website, you can also look at our, give me one second. You can look at our past area plan if you're kind of curious what ends up being the end result from all this information that we collect. A little further down our page here. So under the program information section at the bottom, there's the area plan from 2020 through 2023, and then updates. So you could click that, and then look into what our area plan was for that period of time. So that kind of gives you some perspective of, what we then make of all the information that we receive in the community, and then how we pair that with our other funding that we get, and that certain things that we try to always have going as part of that funding. So yeah, you can also see that. So thank you.